is the Director of Evaluation and Partner Contracts here at SIRC. She leads her team in working collaboratively with state and local partners to design and perform evaluations, provide trainings, and disseminate findings aimed at preventing, reducing, and eliminating health disparities. So without further ado, I am happy to welcome Wendy and her team.
Hey. Thank you very much. Welcome everybody to the SIRC lecture series here today. My purpose here today is, as it says, meeting community partners' needs for evaluation. And I want to talk about that in terms of who we are here at SIRC Evaluation, how we make that happen. So who we are, what we do in meeting community partners' needs, why we do it, why it's so important, and with who do we do it, who our partners are as well. So hopefully be able to talk about that with you a little bit today and provide some explanation. As I said, the first question that I really want to answer today is who we are here at SIRC Evaluation specifically. We are an office of SIRC, SIRC being the Southwest Interdisciplinary Research Center, a center of minority health and health disparities work. And indeed, in the Office of Evaluation, we focus on health disparity, health equity work, substance abuse prevention work as well, and really work with partners very collaboratively in doing that. To do that, I have a wonderful team that has come together to work with our partners in doing all of that. And what I'm going to do, since many of them are here today, is have them each introduce themselves to you in a moment. Again, I'm Wendy Wolfersteig. My background is actually higher ed administration and research, so bringing a lot of project management as well as applied research to this position. I've also worked in substance abuse prevention for 17 years at a previous center prior to coming to SIRC over 8 years ago now with substance abuse prevention. If you are looking at that picture on the, let's see, if you're looking at the picture, it would be on your left side. The first person is Diane Moreland. She is not here today. I've worked with her for many years, and she works with us part-time. Craig Talmadge, the gentleman there, has just left and become an assistant professor in Syracuse. He was with us through the previous year. And I believe everyone else is in the room here today, so I will have them introduce themselves. We have a fairly large staff of research analysts, postdoc, master students, and indeed this and somewhat steady and yet lots of people changing, especially doctoral students through the years. Let's start with Holly. And if the rest of the team wants to come on up.
Hello, I am Holly Figueroa. I have been with SIRC for most of my Arizona life in one form or another since 2005. I've been with Wendy since 2009 at the Office of Evaluation as a research analyst working on a lot of projects, primarily recently in public health policy analysis work.
I'm Grant Yoder. I'm a research analyst. I've been working with Wendy at the Office of Evaluations for about 7 months now. Prior to that, I was doing my master's in community development at Vanderbilt, and prior to that, I was in the Peace Corps.
My name is Katie Morales, and I have been at the Office of Evaluation for just 2 years. I had my 2-year mark in January, and I work on the Flores Project and work with the Phoenix Indian Center and Native American Connections doing evaluation work.
I'm Wanda DeCrow. I've been working with Wendy and the SIRC crew for about 3 years now, and I'm the coordinator and work very closely with Gwen on taking care of contracts and budgets.
Hi, I'm Kate Ham, and I have worked with Wendy for about 17 years in one capacity or another in a variety of evaluation on prevention programs, including bullying prevention, drug and alcohol prevention, tobacco prevention, and most recently, teen pregnancy prevention.
Good afternoon. My name is Kendra Williamson Enriquez, and I'm a postdoc researcher with Wendy and the team. And my primary role is to work with the EPI work group and helping them to develop a curriculum for substance abuse and the community data project.
Hello, my name is Vern Harner. I'm a second-year MSW student, and I've been lucky enough to secure an internship with Wendy and her team, so I've been able to have a hand in a lot of the projects that they've had going on. I've been at SIRC through August, and I will be leaving at the end of this academic year.
Anyway, thank you to my team, but I very much believe that a lot of your success, a lot of our success is due to the people. We all have our areas of knowledge, we come forth with that knowledge, but it's always this interaction with people, and especially that's important when you're working with community partners. It's all about those relationships, and I'll talk about that a little bit more as I go through here. And so being able to put the names and faces together really is one of those things that we work at very hard in connecting with our community partners. You'll see a few additional students who are not able to make it today: Megan McCleary, TJ Reed, Cindy, Adriana Ortiz, and then of course I need to acknowledge Dr. Pat Dussman and Mary Harthu, who are of course not students, but are ongoing SIRC staff members whom we borrow and use their expertise on many of our projects as well. So I think I've already mentioned, but let's do so specifically, what this office does. We work in partnership with a lot of local partners, local healthcare providers, city government, county government, state government, as well as national agencies, often as the external evaluator, because many of the federal grants are requiring external evaluators. So when our partners get those grants, they then need someone other than themselves to evaluate the grants, and we are available for hire as their contractor to be able to work with them and fulfill those grant needs, specifically when they're, again, looking at those kinds of evaluations on their research-based interventions in the areas of preventing, reducing, and eliminating health disparities and other health-related issues. We work with community partners not only on evaluation, but on training, on capacity building, basically on providing most any kinds of services. A lot of times it's just consulting services as well. Sometimes it's webinars. And we do so in that whole community-based participatory research fashion of really working hands-on throughout the entire project with our partners, and especially when they're looking to see if their programs are evidence-based or if their evidence-based programs are working in this new setting, or if what they've been doing locally can be rated or looked at as an evidence-based program. So we help partners to answer all of those kinds of questions. Dr. Marcelia and SIRC in general discovered the need for an office of evaluation through their community advisory board, through people coming to SIRC wanting that kind of expertise in health evaluation and health research. And so started this office with myself half-time in 2008, and you see that we have grown in that period of time quite a bit, because again, this is a need that was expressed by the community that SIRC decided to go ahead and develop to have out there as an available service. Quickly, I'm going to talk about the difference between research and evaluation. So why this Office of Evaluation? SIRC is already doing research. Are they the same? Are they different? And we often get asked that basic question. So research, as we all know, is that idea of the formal systematic approach to scientific methods, where you take a hypothesis and you decide to apply it to a situation. You set up all of your parameters, you set up your experiment, and you see if it's going to work, whether or not you can prove your hypothesis using the scientific method. Evaluation asks a slightly different question. It asks the question, is the program effective? Did it meet its goals and objectives? And in that case, it's measured by the outcomes in participants. Were people able to change their attitudes, behaviors, knowledge, or skills because of the programming? And what kind of information, data, researchy kinds of things can we do to answer that question, is the program meeting its goals and objectives? So again, a slightly different bent with research more looking at the hypothesis, the what-ifs, and evaluation saying, oh, but we have something, and what's happening with that specifically. And so again, this research is much more the idea of the experiment, setting up the randomized control design, so you really have that true experimental design, whereas evaluation is much more about what is really happening in the field with this situation in this program, not necessarily in comparison to other things. However, there is very much the similarity in that evaluation uses research methods in terms of surveys, focus groups, how data are collected, looking at making sure you have valid and reliable research instruments, having people who are well trained. And so there is those kinds of similarities in how you go about doing those measurements in evaluations similar to research. And indeed, often it's talked about as the difference between the developing theory, answering those hypotheses questions when you're looking at research, that very pure, basic idea, versus being out there in the real world and solving problems. Applying that research, or applying those research methods to what is going on at the city, county, state, health provider on a day-to-day basis. How can I, out there in the real world, help make better decisions, have that information for decision making that's stakeholder focused and answers key questions. So much more that applied day-to-day problem solving application is when you look at evaluation compared to the research. And because you know this, but we don't often think about it, there are several types of applied research, of which evaluation is only one. All of the R&D, the research and development that businesses do, is applied research. Will it work under this circumstances? How do we have to make that rocket different? How does Apple go about making a new iPhone? All of those things that go into it are, in a sense, looking at research techniques, eliminating possibilities and hypotheses. The other type of applied research is action research. Again, this is often done in school settings. My goodness gracious, if we teach it this way, will it work different than if teacher B teaches something this way? And what are the alternatives to selecting textbooks or teaching methods? But I've got to do that tomorrow in my classroom. And so it's very, very applied action research that people in the real world often have to go about immediately to figure out what's going to work and then look at continuous quality improvement. Just so you know, the field of evaluation is indeed its own field, with its own large association, the American Evaluation Association. I've had the privilege of going to that conference for many years, where they talk about evaluation methods, and one of the big pushes in the last years, which impacts on the kind of work that we do here at SIRC, is that they have come out with a statement on cultural competency in evaluation. So this was a very important effort that they went through that impacts all of our work in health disparities as well, to know that when you're engaging with the public, you really have to emphasize the importance of the cultural context and diversity in evaluation if you are going to do that kind of work. So this is important to us at SIRC in general, and especially to SIRC evaluators as we continue to work with our community partners. So why do we evaluate? Sure, data are nice. Those of us who are very geeky love lots of data to be able to use. Okay? But what can it do? Often in the practical world, people go, why do I need to bother to collect data? I know this is working, it feels good. Nah. You need to bother to evaluate and collect data and know what you're doing for many reasons, including things like clarifying your objectives. What the heck are we trying to accomplish? What do we want our outcome to be? There have been programs over the years that do good things, just not the things that accomplish their objectives. It helps you to look at the costs and the benefits of the program. Are we spending our money in the right places? Are we really benefiting the people that we say that we're benefiting? Or maybe we're benefiting ourselves as trainers because, my gosh, I've learned something new. Is that another outcome? Having data helps us to modify ineffective things, that idea again of continuous quality improvement. Make it better. And that's where being in the field, you don't want to do it next week the same bad way you did it the week before. You want to be able to change immediately if that's possible. Administrators always need information for decision making, whether it's about spending money, personnel, what grants to apply for. And so it really does go on through that whole idea of how are you allocating staff and staff resources, let alone other kinds of resources. And if somebody else, which is most likely the case, is funding you, they want to know that you are spending their money wisely. And so having some data to be able to answer that question is an absolute must. It can also help you to influence policy directions. If you're doing something well in substance abuse prevention and being able to provide that information to legislators, to other stakeholders who have money or wish to contribute money to your cause. It also can motivate participants in terms of when you're out there recruiting and you can tell parents that this program really works and that 95% of parents who just took the program said this and learned this. Well, why wouldn't you as a parent want to come sign up for this program if it can help you? So it can really be, in a sense, that motivator for your recruitment efforts as well. It helps make your organization look good when you have the data to say, here is what we are really accomplishing toward our objectives. It gives you a track record. It's that good information for your public relations and funding efforts. And when you want to do that program again, you have some reason to sell it to all of your stakeholders, your participants, and your funders and your policymakers. And therefore, even if you know that you're doing a good job in the field, having a formal evaluation data, evaluators who are trained in the field, an evaluation report is very, very helpful to you as a local organization, let alone if it's a federal requirement for your funding. There are many definitions of community-based participatory research. This one from the Kellogg Foundation emphasizes a few things that I think are important to us here at SIRC. Talk about equitably involving all of the partners in the research on a topic that's important to the community. So it really is bringing together the community partner, the researchers, the evaluators, to look at how we can improve our health outcomes. And so this is very much, again, the focus of what we do in the Office of Evaluation. Working with community and meeting community partners' needs has many challenges, yet is extremely rewarding. That's why I stay in this business. Time. Time and more time for walking people through what things are going to be, for explaining timelines. It always takes longer than you anticipate because, again, you are bringing people together, trying to schedule meetings, trying to make things happen within usually more than one organization or system. And so getting all of that together just takes time. As does building the relationship. Sometimes you know one person and maybe they know you in the organization, but as you've just seen, I have a team. And as you'll hear in a minute, there are usually 2 or 3 staff assigned to every project, just so we have backup and more backup. But that means there are several people on my staff who need to get to know several people on the community partners staff. And if you're partnering with more than one organization, which we do quite often, again, you're bringing together lots of different people, needs, into really trying to put that together. And so it is a very time-consuming, rewarding, but time-consuming process. We also work on a variety of topics. So the broad scope, some of which you heard at the beginning, talking about everything from training, telling people or helping people to learn how to get data, the various health issues involved with risk and protective factors. Substance abuse prevention has often been our focus, but we know that things like bullying, teenage prevention, pregnancy, many of the criminal justice issues, all have many of those risk and protective factors in common. And so to some degree, I like to think us working around those common risk and protective factors almost more than saying we're in substance abuse prevention, because that then encompasses all kinds of things, including educational programs as well. And so bringing those topics together, we've been recently working with a food bank, so food insecurity, housing insecurity, are all related around those same risk and protective factors. In the community also, defining research. You walk in sometimes and you go, you even use the word research and you can just see everybody in the room bristle. We're going to do research. We're going to do applied research evaluation that's going to meet your needs. That's another reason it takes time, is to walk through and talk through what are those needs. Do you have objectives that are measurable? We love when we can help write your grants from the beginning so that we can write very specified objectives that are measurable. We find that oftentimes health agencies want to solve the world's problems with one small grant, and therefore the objectives are very broad and not always measurable. We've just gone through an exercise of spending several afternoons, I know, helping a group to rewrite their objectives and making sure that the activities were activities, not objectives. Because objectives, again, you're looking to measure the outcomes in your participants, attitudes, knowledge, behaviors, and skills. Not did we run the program 6 times. Yes, you need to count that you ran the program 6 times, but that's a process measure. It's an activity. And so working with your community partner to understand what it is you're going to measure as part of your evaluation. Do we need a comparison group? How are we defining the research/evaluation that you're going to do? Is a challenge. Helpful, but challenging. So again, you're going to see me emphasize this idea of building the partnership. Really working with the people in the organization and getting to know more than one person in that organization, because people leave. New people are hired, even over a period of a year or 2. That's just how it is, and especially since we're working in social service and government agencies. And it's good that people leave and get promoted and do all of that, but it means we need to learn new people and what they're about and who's in the organization. And so just as I introduced my staff to you, I introduced them to the people in the organizations that we work with and want to make sure that we know many people in their organizations as well. And oftentimes we start work with a pilot project. I got a call the other day, can you come talk to us? We are already in year 6 of our project and we need some evaluation. Well, we will go and we'll consult and we'll find out if indeed we can possibly be helpful, but this is working on establishing a relationship with someone who thinks they may need some evaluation work done. And so again, things that we really work at are hiring and keeping people who are committed to the project, establishing clear roles, clear procedures, teaching people how to work through IRB kinds of things. How do you consent your participants? Because even in evaluation, we do all of those IRB protocols that are done in research studies. So that's another similarity. So getting people to understand those things. Holding regular meetings and trainings with people. So one of the words in evaluation, we do lots of trainings with people. And it's trainings on how to do things like consent to your participants. Making sure that everyone in the organization is using the same language. What does fidelity mean? Oh, we should all teach the same thing out of the manual, not give, our own examples. No, that's not going to work real well, except in certain circumstances. So having all of that explained and working with our clients and community partners to make sure they understand that. And so to build that successful partnership, you have to be available to your clients, build the relationships, go visit them. Phone calls are nice, but not nearly as nice as having your face across the table from your partner. And so we do a lot of legwork. And then we meet and exceed people's expectations, and we deliver what we promise. Specific now to the kinds of work that we've been doing. I've already mentioned that we do a lot of consulting. If you would like to see examples of our reports, they are on the SIRC website, as are examples of our webinars. We have done multiple series of webinars over the years. The latest was, you'll hear me talk about in a minute, part of our project with the Florence Unified School District. We did a series of 4 webinars on child welfare, child abuse and neglect, and mandatory reporting for a school district. This was actually part of a professional development seminar for all teachers and many of the staff in the Florence Unified School District through a grant that we had. Those webinars are available online. We did a series several years ago, 3 series I believe it was, on issues that were important to the lesbian, gay, bisexual, transgender, and questioning or queer community that was done by those members of the community. We hosted, and those seminars, webinars are available as well. We've done multiple series on different strategic planning and evaluation and logic models. And we have done many on the community data project, which you'll hear me talk a little bit more about in a minute. This is a website and how to use data. Again, out and about in the community, what they know a lot of is conference presentations. And so most all of the large Arizona health equity related conferences, someone from SIRC Evaluation is doing a presentation at those conferences. You've already heard me talk about different training that we do at SIRC and on different evidence-based programs when we're called upon to do that. We participate in helping to write journal articles and newsletter articles. We participate as part of SIRC. I'm a member of the SIRC core team, the Community Engagement and Outreach Core, and the RO1 that has been looking at American Indian parenting programs here as well. a bit of dollars, but bottom line, this office has brought in over $5 million in the last years. Anything from small $5,000 consulting contracts to over $1 million. $1.2 million was one of our large ones. So, let me just say that this takes a lot of my time and effort. Because as director, not only am I working with the clients and with the grants, but working with ASU and working with everyone to make sure that all of this is in order, because we are totally self-sufficient at SIRC Evaluation. We're very proud of that we don't rely on the university for anything. We rely on our community partners. And our community partners have been the ones funding us and said, this is important work. Here's some money to come help us do that work. Examples of projects and people. One of our favorite clients, and I'm actually going to get back to this one in a minute, is the Maricopa County Department of Public Health. I've almost lost track of how many, but it's close to 7 or 8, maybe even 10 projects that we have had ongoing with them in the last years and still ongoing. Last spring, summer, we did a project called the Shared Use Roosevelt Project. Maricopa County Department of Public Health, in collaboration with the Roosevelt School District, was looking to see about opening up their schools for after-school use, summer use. What did the community think about that? And so it was a very involved process of doing some mapping, focus groups, bringing together community groups to find out with the school, as well as the county participants, to find out how might that best work. We've also been working with the Maricopa County Department of Public Health on teen pregnancy prevention. The newest grant is on capacity building. So it's the county. Here they're also working with several behavioral health agencies, Touchstone and 1 in 10, to build their capacity in these agencies to develop teen pregnancy and to develop and offer teen pregnancy prevention programs. And we are helping them to build the capacity of the partners, of an advisory board, and really look at how do you roll out those kinds of programs. Again, a project that required an external evaluator and has multiple partners involved. Native American Connections has a federal SAMHSA pregnant and postpartum women's grant. We are again fortunate to be asked to be the evaluator on that project over the past 3 years. We're now in just starting into year 2 of that grant, helping them to look at how they offer services through their circle of strength, very specifically American Indian focused for women, making it very culturally responsive in terms of doing that kind of programming. St. Mary's Food Bank Alliance, I believe that 140-some page report is due to go out the door this Friday. They came to us, they were basically taking bids to work with them in 3 northern Arizona counties, Coconino, Mojave, and Navajo, to find out what were the needs for summer food programs. They had some established. They wanted to be able to, they're working with a federal partner to expand that programming and wanted to know where were the needs. So all fall, we've been hightailing it up to these counties to do focus groups, surveys. We've also done interviews, phone calls with stakeholders, online surveys with stakeholders, and city by city, there are 9 cities that we visited, 9, 10 cities that we visited. We have a city-by-city report, I'm going to say 140 pages, about to go out the door to them. Technically, this piece of the contract ends in April. However, they're anticipating continuing having an evaluator, because once they decide what to do, then they have to do it and see if it works. And we were lucky enough to have an initial conversation with them to say, oh, you don't just want a 3-month somebody, you want somebody to help plan it, have conversations, plan the next part, and continue as your evaluator. So again, this idea of food insecurity very much impacts people's health and well-being. One of our continuing clients over the years is the group that is now the Governor's Office of Youth, Faith, and Family. Formerly, this was the Governor's Office of Children, Youth, and Families. You may know. And the EPI work group, some of you may know I've been on that group for 10.5 years. I had the privilege of chairing it for over 4. That group has continued in the state and bringing together substance abuse data. SIRC had the privilege several years ago of developing a curriculum to help teach community coalitions and health providers how to use these data around substance abuse. And specifically then, we used to do 400-page reports. Much of this data has now gone online. Specifically, the Arizona Criminal Justice Commission has been doing a community data project website with many of the Arizona Youth Survey data on it. Department of Health Services has their new profiles page where you can now go and get many of their emergency room and vital statistics online as well. And there are many other websites. And so because those websites have continued to change, the Governor's Office put us back under contract to revamp that curriculum, and beginning tomorrow with a training of trainers, and then in February we're going to be offering more regional trainings. What I'm holding up here is the new manual. It looks small, but we printed both sides of the page for that curriculum. So again, teaching people how to find the data that they need to make decisions that are out there, that are the secondary data sources, and be able to pull those together and use them, and then how to use those data to help guide many of the questions and other things that they're going to be asking about their programs as well. So they would have county and state data to apply to their situation and maybe ask many of those same questions about their participants. So this is another piece of work that has been ongoing for us over the past several years. Another large project has been also, it's funded through the Parents Commission on Drug Education and Prevention Programs, which is administered through the Governor's Office of Youth, Faith, and Families. We are in the 4th year of the Brighter Futures for Florence Families project. That 295 is a 1 year. The other years back had approximately the same amount of money for each of the previous 3 years. The expanded version started a year ago and is an 18-month project, and it helped us to expand to all of the schools in the Florence district, as well as add some additional curriculum on child abuse and neglect, and that was the project for which we did those webinars. You'll see Ms. Mary Harthoon here has been one of our wonderful trainers, because what we've been offering has been the Families Preparing a New Generation. Dr. Pat Dussman joins her when we train teachers in using the Keeping It Real program. And so the other photo there is 4 of the teachers who were in one of the teacher trainings for the Families Preparing program about a year ago. But we have been able to offer those programs in all of the schools in the Florence Unified School District. Grant and Katie both have worked on that, although again, all of us have been to Florence to administer surveys and do whatever it is that we need to do right down the road here in Florence. Through Parents Commission money, they also fund many other health providers, including Friendly House, who then hired us as their evaluators. Child Help, which is a child abuse and neglect agency here in Phoenix, also hired us to be their evaluators on their Parents Commission grant, and after getting to know us, said, oh, by the way, we are further developing our own curriculum, Speak Up, Be Safe, and could you help make that evidence-based and provide some teacher and facilitator training for that? And so once again, we have been brought into a broader sense of working with a community partner to do that kind of development and training work. We've had the privilege of working with the Akimel Ohodum Peeposh Charter School on the Gila River Indian Reservation for 12 years at least. Before, this is a project Kate and I have worked on before SIRC, and now are working with their 21st Century and their Office of Indian Education programs as well as evaluators. We work with Phoenix Indian Center, have worked on their Parents Commission grant for 6 years now, as well as on their new Robert Wood Johnson evaluation of their college and career readiness program. We've worked with the City of Phoenix in terms of their housing redevelopment, so looking at housing insecurity. This is the second City of Phoenix grant for housing that we have worked on. And some completed projects. So here again you see the teen outreach. We just finished a 5-year grant with Maricopa County. Previous work with the Governor's Office of Children, Youth, and Families, both on the Parents Commission grants and on the EPI Work Group grant, as I had previously mentioned. As well as working also with Gila Crossing School, other evaluations with Blackwater, Magellan, which had been the REBA in the county for a while. We worked with them on many of their evaluations. Terrace is another group that SIRC has worked with for many years, and we have worked on their drug-free communities and right now on their alcohol-free quinceañera evaluations. We've had large contracts with the Arizona Department of Health Services for general evaluation services and evaluation database, and a lot of our webinars and trainings were their efforts as well. They also had us help reinvigorate the Arizonans for Prevention group, which had waned quite a bit. And I will much give credit where credit is due to Holly Figueroa for really helping to provide the assistance that that group needed to figure out their sustainability efforts over the years. We worked with ADHS as well on their youth suicide prevention grant for targeting LGBTQ youth. Hope 6, another grant with City of Phoenix. We worked with St. Luke's. They did an Arizona adult survey years ago. We did 4 different reports on analyzing data there, one on food insecurity, access to health care, as well as substance abuse, and veterans. We've had the privilege of working with Dr. Krista Johnson-Obikwu on the Susan Komen Breast Education Grant for Somalian women. So again, I think you're seeing the breadth of both partners, partnerships, target audiences that we have been comfortable working with and who have been comfortable in working with us, which is very, very important. It goes back to my initial conversation about building relationships, knowing who the people are, knowing that you can relate, that you can understand the cultural diversity. And I think that's really my point in going through here, is to point out the difference, and yet the wonderfulness of the difference in coming together and yet having that same need for evaluation data, and seeing that SIRC evaluation and SIRC in general can provide that cultural basis for all of these many different topics and partners and people for whom these evaluations and these data are targeted. I'm going to take a couple of minutes to mention 2 of the other big projects. The Florence project has been one of them, working with the Phoenix Indian Center, as I said, for 6 years on their curriculum development. They started in using the Families Preparing a New Generation. SIRC was extremely interested in how this program would work with an American Indian urban population, to the extent that Dr. Stephen Coulis then went ahead and, with, again, the Phoenix Indian Center as partners, was able to get an NIH R01 grant to really do the cultural adaptation of the Families Preparing through the pilot project, through a randomized control trial, so that these years later, at the end of, in a sense, the 6 years of the parenting grant from the Parents Commission and the R01, there is now a adapted, tailored curriculum by knowing that they were going to need data. Starting with an evaluation, you had some baseline data, able to put together all of the pieces and the partners from Flagstaff and Tucson and Phoenix and the researchers and the evaluators and the governor's office. Lots of partners, lots of talking to put that together. But it has really, this few years later, developed into a very specialized curriculum for this target audience that now really, really, really meets their needs that they had identified in the needs assessment probably 8 or 9 years ago. So we see that as a huge accomplishment. Another partner that I wanted to come back and highlight as well was the work that I've done, and actually all of SIRC has done, with Dr. Bob England, Dr. Eileen Eisencohen at Maricopa County Department of Public Health. You heard me mention the SURE project, so everything from looking at schools, looking at 2 teenage prevention pregnancy programs. They are the ones who actually funded the assessment for ASU evaluating its own tobacco no smoking policy. When the ASU put in the no smoking policy, the county asked, are you evaluating it? And ASU said, not really. And so the county, who had this interest, they had helped the Maricopa Community Colleges implement such a policy, wanted the data, hired SIRC Evaluation to evaluate ASU's no smoking policy. So we went and looked at everything on the campus in terms of talking with faculty, staff, student surveys, staff surveys, going out and counting tobacco litter on campus. All of those kinds of things to bring this project together. We've looked at issues of obesity prevention with the county. I'm sure I'm missing 1 or 2 in here, but all of those kinds of things up here, really coming back and working with us and establishing those kinds of relationships. I need to mention as well, Dr. Eisencohen is on the SIRC Community Advisory Board. Much of this work with community partners is through the SIRC Community Advisory Board. It is indeed many of those agencies with whom we do business, or who wanted to do business with SIRC. This is what started the Office of Evaluation, was members who are on the board, from Taros, from Phoenix Indian Center, saying they needed help, and SIRC being able to now meet those needs through the Office of Evaluation. It's good to have a plan. You need to have a plan. I stress to my evaluation clients, where's your plan? Where's your time frame? Where are your goals and objectives? What are your strategies? But in the community, life gets in the way. Focus groups get canceled because of snowstorms. If they didn't have school that day, chances are parents aren't going to come to the focus group after school because there wasn't school today. Life gets in the way, and you have to make those adjustments. And so that is, again, one of the things I'm going to go right back to. That's been one of our big things, is being able to be a flexible, adaptable, know who our partners are, know, oh my goodness, yes, this is a hard and fast deadline, or no, wouldn't you rather we take another couple of days, work with you, have some more conversations to get the report the way that you want it, or that you need it, to be able to put those pieces together to meet community needs. And I very much feel that that is a strength of the SIRC Office of Evaluation and Partner Contracts, that we really do work with our partners to meet their needs. And with that, I am going to thank you very much for your attentiveness today and open the floor to questions. Questions? And if there are no questions, I will say have a wonderful Wednesday, and again, thank you for being here and being attentive today.